So welcome everybody. It's our Salford Dementia Action Week webinar. And the national focus this year is around increasing diagnosis following the drop during the pandemic. So we have a group in Salford called the Dementia Providers Group, and it's been running a long time. Mind you, some of us have been around a long time as well. So passion since 2012, I think, since the Prime Minister's challenge, we've all been trying to work together to commit to best practice and to support people with dementia and their carers. So we've organised this, and it's the first one this year. So we'd really like your feedback if I can send you an email after this. And we're here today for anybody who's professional or what just wants to know what's happening in Salford. So, and we might do some more of these for certain weeks during the year around dementia and carers. So, and this session's been recorded so we can put it on YouTube and put it on links. So I hope you're okay with that. Emma, have you started recording?
I have. I was just waiting for a moment to say I'm recording this and we're going to share it on YouTube for anybody who can't make it. So yeah, I'm guessing the presenters are all fine with that, and participants, well, we can't see you, so.
Yes, so we have asked if you can put your job role in the chat. That's great, because then and who you work for, that'd be brilliant. Because I'd really like to know how many people from GPs and social workers and what organisations have been actually interested to come today. So I'm Caroline Allport, as you might be able to see, and I'm the engagement officer currently working with the Salford Integrated Care Partnership. Get that sometime. So, and I specifically work with people, older people, people with dementia, carers, etc. And for the last 7 years, we've been seconded over to the clinical commissioning group. Well, that now comes under NHS Greater Manchester Integrated Care. So my colleagues and I will be going back to the council with the Integrated Commissioners group. So we've tried, as I said earlier, we've tried different ways of communicating. So this year, the providers group came up with this webinar, and we've also sent out a pack of information to all the GPs in Salford. So I'll be asking them if they've had that and what they think of it, and should we do it again, because services do change. So, and if anybody's got any inquiries about the providers group or anything that I do, you can always contact me, and I'll put my email in the chat. My email is caroline.allport@salford.gov.uk. So I'll be changing from the NHS email shortly. So I'll be going back to my salford.gov. So I'll move on now because I'm aware of the constraints, the time constraint, and I'll welcome Leslie Fisher from Dancing with Dementia.
Hi, I'm Leslie Fisher and I'm the chairperson of Dancing with Dementia. We've been around now for about 7 years. That's soon gone, hasn't it, everybody? But we have grown, and we currently have 5 events a month.
Any details?
Usually on the second Monday in the month, we have at the Grand Palais on Station Road, which is a ballroom with a licensed bar, and it is just about having fun and getting people up and moving. The idea is to keep your brain alive, come dancing, basically. So after the pandemic, we expanded and we took over from June Smith, who did the Singing with Dementia, and we changed the name to Music and Dance with Dementia, and we have that every Wednesday morning at Humphrey Booth Resource Centre on Worsley Road. And again, that is proving to be very popular. We're attracting over 100 people on the Monday events, and we are almost at capacity now. Over the last 10 weeks, we've averaged 76 people a week at the Humphrey Booth Resource Centre. So we know what we're doing is so needed. We are working with other things as well, but our predominance is these two events. They're for people who are living with dementia, their family, friends and carers, but we've also opened it out to older people who feel isolated, lonely or depressed. After the pandemic, there's been an awful lot of people falling into that isolation and depression bracket. So we are opening out to them, and a lot of our volunteers have walked the dementia journey. They know what it's like, either living with the condition themselves or caring for a loved one. And it is a very challenging time. And when that job role finishes because the person's either gone into long-term care or they've passed away, they've had a double whammy. They've lost the person they loved and they've lost the job. But they have a wealth of empathy to show the other guests who come to Dance with Dementia and Music and Dance with Dementia. So we find that we support those people and we give them a role that they can focus on by becoming volunteers for Dancing with Dementia. So we've got a whole host of people who fully understand the emotional turmoil of living with dementia. I think I'm in. Have I gone over now?
Oh, Leslie, no, you're absolutely perfect. You've clawed some time back, so it means that we can open up. And if anyone has a question for Leslie, then please take your mic off and ask that question. Alternatively, you can type it in the chat, but we'll just give you a minute or so if anybody wants to ask Leslie a question before we move on to Mary Ann.
I'm glad when there's no questions.
They're just typing them in.
Oh,
if you want to type questions, we'll pick up some questions at the end as well. So if you want to type some questions in, we'll make sure that we have a little bit of time at the end. Oh, OK. Yeah. Do people just turn up to Dancing with Dementia or do they need a referral?
They don't need a referral. On the Monday sessions at the Grand Palais, you can just turn up. If you're a care home or you're bringing several people, then we will ask you to contact us and you'll have our details so that we can reserve a table for you. It's getting a little bit more tricky at Humphrey Booth at the Poppy Day Centre there because of sheer size. We need another room. I keep asking Chris to build a mezzanine floor. He doesn't take me on. No.
I'm on it.
So we are a little bit caught in a pint pot at the minute, but we're not saying no, don't come, but we're saying if there's more than 2 or 3 of you, then please let us know, then we can reserve a table. So with no panic, no anxiety about finding a seat, that we will allocate a seat for you. But if it's just yourself and somebody else, then that's fine. You can just turn up. There isn't a problem with room at the Palais. It's just on the Wednesday sessions that we need to be a little bit careful now because we're almost at capacity.
That's brilliant. Thank you, Leslie. And if anyone has another question for Leslie, we'll have some time at the end where we can pick those up. So I'm going to move over to Mary Ann now. Hi, Mary Ann.
OK, lovely. Thank you. Good afternoon, everyone. Lovely to see you all. Yes, so my name's Mary Ann Byrne. I'm the manager for Age UK Salford's Dementia Support Service. So our service is commissioned by the Integrated Care Partnership. We have a team of 10 and they provide information, advice, practical and emotional support for those affected by dementia and their families. We have an open referral system, so anyone can refer to us. You don't have to be a medical professional. We just ask that you get permission from the individual before you make that referral. You don't have to have a formal diagnosis. So if you're supporting anyone who's living with dementia, living with a memory problem, but they haven't been diagnosed, they can still get support from our service. what we will do, we'll just encourage them to go and visit their doctor and sort of get on that pathway for a diagnosis. When we receive a referral, you'll be allocated a dementia specialist who will complete an assessment and agree a support plan tailored to that individual's needs. So the kind of things in a support plan, there'll be lots of information there, advice, they can refer on to other services, and they can help carers with the day-to-day sort of coping, teach them sort of coping mechanisms. They do provide a lot of emotional support. And they can also refer into our internal groups. So we have a range of social groups. So I'll tell you about those. On a Tuesday every other week, we have a dementia cafe. That's in Clifton, and it's for the cared for and the carer to come together. It's a social group. It runs for 2 hours. They do a range of activities. They like to go out for tea, and they've even been on holiday to the Salfordian together. I don't know if you know that, it's a hotel in Southport. We also have our buddy clubs, so we have one on a Wednesday and one on a Friday. Now they run from 10 till 3, so it's for 5 hours, and that is specifically for the person living with dementia. The purpose of that is to give them some independence and to give the carer 5 hours respite. So during those groups, they'll arrive at around 10 o'clock, have tea and toast on arrival. They'll do a range of activities throughout the day. So some will be cognitive, some will be physical. They'll do crafts, singing, dancing, a wide range of activities. They're supported by our 4 support workers and some volunteers. Then on Thursday afternoon, we have our walking football group. So we are working with Foundation 92 on that group, and it's been going now for just over a year. Again, that's for the carer and cared for. So it's for 2 hours, and it's just an opportunity for them to get outside and get some physical exercise with a group of friends. What else do we have? We have our Forget Me Not group, which is on a Thursday afternoon as well. That's in Clifton. That group focuses on younger people living with dementia. So, and again, carers can attend also, and that's supported by our support workers as well. We also have, sorry, I'm getting swollen glands, so. But anyway, we also have, we're starting a new course of micro workshops. These are for carers, and we did a consultation at the beginning of the year to see what kind of topics people wanted to know more about. So they said things like legal and finance, caregivers' rights, basic first aid, moving and handling, carer welfare. So they're just to name a few. So we'll be starting them during Carers Week in June. Some will be online and some will be face to face. So look out for those. I can send details on afterwards. So all our groups, I have a list of all our groups. Some of them are chargeable. So I can get that list to you. I can either share it in the chat or I can send it to Caroline and she can email everybody, whatever's best. I can also share a link to our service video. We have a 3-minute video that actually gives you a better flavour of what the groups do and what the service does, better than I can tell you. It comes from those that we support, so you can really see sort of the positive impact that we have. And then last but not least, those of you who are GPs or practice managers or represent their medical practice, you should have our referral form on your system. It was adapted so that it follows the format of all your other referral forms. So if you have any patients who are concerned about their memory or who have got a diagnosis of dementia or care for someone, please just refer to us and we can start supporting them within 5 working days. So that's me. I think I'm within 5 minutes, am I?
You're absolutely spot on. Thanks, Mary-Ann. Does anyone have a question for Mary-Ann before we move on?
Could any of our volunteers go on any of the training programmes, or are they specifically for the carers?
Well, they're specifically for carers, but if there was a need for volunteers to do some kind of training, I'm sure that's something we could accommodate. We could do one just for volunteers.
Yeah, okay.
Barbara, I noticed that you had your hand up there. Do you have a question?
Yeah, I've got a cancer patient who is caring for her husband, and her brother-in-law gets respite. So she's able to go, she wants to go to an art class, And I wondered, I've been trying to find out if there's any such thing where somebody will come in, take him out, and so she can go out.
Right, okay. Is that somebody with dementia, did you say? Sorry, I couldn't hear you
Yeah, the
properly.
husband's got dementia and she's unfortunately got cancer.
Right, okay. And you want somebody to come and take him out? That's what you'd be looking
So
at.
her brother-in-law has somebody who comes and takes him out once a week, and she's asking me to try and source similar for her.
Oh, well, maybe our buddy clubs would be suitable. If we can arrange transport to get him to and from buddy clubs, he could come and spend either a Wednesday or a Friday with us. That'd be 10 till 3. So I can definitely pass on some information if you want more details on that. That'd be helpful.
Marianne, thank you.
Kathy's got a hand up.
Hey, Caroline, don't be cheeky. It's my role, that. Kathy, have you got a question?
Sorry to interject on Marianne's question from Barbara. Just to say that social services also offer support workers that take people out for the day, and there's another service, a private service called Home Instead, that we can put the information on there for you to contact.
Conscious that we've got quite a few social workers on here. Maggie, do you want to say something?
Hiya. Yeah, so the buddy club, there's a cost to that, isn't it? Is it £35 for the session?
Yeah.
Okay.
Yes.
And so prior to, you said that you might be doing a bit of training. One of my colleagues passed out an info sheet from Age UK. I think it was dated back in November. So referrals for your services, people could just drop by, or do they need to be referred in?
Oh yeah, no, sorry, they need to be referred in. It's just so we can kind of monitor numbers, and obviously at some of our groups, if carers are not attending, we need to make sure we've got the right staffing levels and we can provide the right support. So all our groups would be referral only. So if you refer to the service, even if it's just for a group, you'll be allocated a dementia specialist, and then they'll refer into our groups if that's what you know, the individual wants.
And the referrals, is there a referral form on your website?
Yes, it's on our website.
Yeah.
So again, I can send you a link to make that easy if that's helpful.
That'd be
really
really
it's on our webpage.
Like,
if you go on the
today one. Yeah.
Brilliant.
I think we'll get Marianne just to drop that in the chat if that's okay, Marianne, so people have got
will
it.
do.
And for anyone who, so we have sent out packs to GP practices, but if you're not from a GP practice and you want information from the speakers, I think what we can do via Caroline is we can compile like an email with lots of attachments of referral forms and information of anything that we're talking about, and we can share it with you that way.
Right.
Okay.
Can you send me the information that you've got, please, that social services provide? Fabulous, thank you.
Caroline, do people need to go through a social work assessment to see what level of care they require? Is that a question for Marianne, Caroline?
You must pardon me, my husband's just coming through the background.
We can't see him, he's just
joys of working from home. Yeah, because we really don't people have to phone social services and get a carers assessment and the assessment for their loved one with dementia to show what level of need that they need, because that's how they get that adult social care to be taken out, for someone to be taken out, don't they? I know Aspire used to do that, but it's gone back to the council now. So I'm not quite sure of what the pathway is about that.
He's already got a social worker.
Oh, so, right, okay.
But they've been trying to get this support and nothing's happened, and so it's bounced back for me to try and help.
I would suggest
right. So Marianne, would your support worker then help with that?
Yeah, I mean, the thing is, like I said, we provide the groups. The only thing we couldn't do is kind of do the transport side of kind of picking up and delivering. But did you say your brother-in-law would be able to do that?
No, the brother-in-law.
Sorry, because I can hardly hear you. See, sorry.
Sorry, the brother-in-law's also got dementia. It's just that she knows that he gets that. So my patient's wife knows that the brother-in-law, who also lives in Salford, has somebody who comes and takes him out so that she can have some respite, if you will. Because of what's going on with the husband's wife, she desperately needs the support at the moment. And I just want to try and help her get some respite.
Right, okay.
Will Macmillan help with that?
Well, Kath said that social services do something, so if Kath sends me that information, I'll sort that out.
Yeah, I'd suggest, Barbara, getting back in touch with your social worker. They'll know about the support workers that can help with that. There is a small charge. It isn't completely free, but I'm sure they'll be able to give you information. But anyway, we'll put that phone number for social services for you to call and maybe just make some inquiries.
I've got the number, love, that's fine.
Okay. All right.
If it's just that, I'll do that. Thank you.
Lisa's just added in the chat. It'll be shared lives. You asked for a referral into a day opportunity centre, so it's shared lives. So I'm just conscious of time. So it feels like, Barbara, we've resolved your question. Fantastic. Okay, so we're moving on to me. So my name is Emma Smith. I'm the project manager with Empowered Conversations, which is a project of Age UK Salford. We deliver communication courses for family caregivers across Greater Manchester. And we deliver 2 courses. We have Empowered Conversations and we have Moving Beyond Words. We deliver them all online. In Salford, we have a programme called Empowered Carers, and we offer one-to-one dementia-specific therapeutic sessions for caregivers around the challenges of caring for somebody with dementia. In addition to that, we run a regular webinar with various professionals, researchers, people with lived experience on a Wednesday, and we've got tons and tons of material on our YouTube channel, so I'll pop it into the chat. So there's so many different webinars there that you might find useful or you might want to disseminate with team members. That's all I'm going to say because I'm just bringing us back on track. Any questions? Oh, Karen, you got a question? Or
I was just going to say, is it free for people to access?
Thanks, Karen. Yes, they are all free for people to access. So the one-to-one in Salford is free. The courses are free. They're all delivered online. The one-to-one's also delivered on phone call if people don't access the internet. Outside of Salford, the one-to-one would be charged for. Jessica, have you got a question?
Yeah, I was just going to ask, how do you get a referral into having the one-to-one support?
So you can go on our website. I'll drop it in the chat in a second, Jessica. So you can just go on the website and put the details in, and then we can contact people that way. Wonderful.
Thank you.
Well, that's okay. Wonderful. So I'm going to move over to Karen. This is your 5-minute spot.
Okay, fab. So my name's Karen. I'm one of the project managers at Dementia United, which is the Greater Manchester programme for dementia. So we're part of GM NHS Integrated Care Partnership. It's now a long title, but the team's been developing over several years, helped by devolution. And now we're a small team of project managers that are working really closely with localities and different partners across Greater Manchester. And the aim of the programme is to make GM the best place to live for everyone that's affected by dementia. So we work collaboratively across GM. We've got a range of different projects, co-production, so with people with lived experience, diversity and inclusion and partnership working are central to how we work. And we've recently launched our 2-year delivery plan for 2023 to 2025. The 4 key areas of that are around system quality improvement, brain health and wellbeing, education and training, and research and innovation. So, for example, we're starting projects at the moment around dementia and end-of-life care, dementia training and quality of diagnosis. And then we also have lots of other projects, including delirium, creativity in care homes, and the dementia wellbeing plan digitisation. So there's lots of information about the different projects on our website, which I'll share. But the key partners in our work are people with lived experience. So we've got a lived experience group, which is for people living with dementia. And we have the Dementia Carers Expert Reference Group, which is for carers or for previous carers, so where their loved one has passed away, who have cared for people with dementia. And these groups are really important. The members of our groups are part of the projects that we're all working on, and they're part of the strategic board, which oversees all the work that we do across GM. So I've got a couple of quotes from people that have been involved. So from someone with lived experience, he said, I would gladly encourage others to become involved in Dementia United's work. And from a carer, he said, I believe we are really valued and respected as experts by experience, which I think is really important. They're a really key part of our work. So if anyone knows anyone who would like to get involved with Dementia United's work, there's information on our website. It's in the Get Involved section. But we are currently recruiting for people with lived experience and carers to be part of those groups, because we don't have representation from Salford, particularly on the carers group at the moment. So if you know anyone who might be interested, the information of who to get in touch with is on the website. It's Amal, one of our project managers, or you can speak to me. I'll put my email address in. And I'm just going to end with an Andy Burnham quote. I think I'm in my time. We will know we have a 21st century NHS when it supports people with dementia as well as it does people with cancer. And I think that's why we're all here. So just wanted to say that. And I think I'm 4 minutes, Emma, 4.
You were brilliant, Karen.
Excellent.
Just one question I've got, Karen, on that. So if anyone has a question, then put your hand up or just let me know. Karen, is it online? So if someone's like caring for somebody at home, is it an online meeting for the carers?
Yeah, so at the moment they do a monthly group, and I think it's mostly online, but they're starting now to move to maybe every 3 or 4 groups they're trying to do face to face. But I think they're going to do it mostly online so that people across GM can get involved, because it's obviously a challenge to travel.
Brilliant, thank you. And Jessica, you've got a question.
Yeah, I was just going to ask, what time of the day are the meetings? Are they at night or tea time?
So the carers group is on a Monday, I think it's 11 till 1. But then the different project groups that people are involved with obviously happen in work time. Are you thinking of carers that are working who might want to be involved?
No one's thinking of me, but I work full time, so I couldn't be involved. I'm a carer. Cheers. Okay, well, maybe have a look and have a chat with Amal, because she's the lead within Dementia United. Her phone number's on the website. Maybe have an informal conversation about how that might work.
Thanks. Any other questions before we move on to Kathy?
Are we good?
Let's go for it, Kathy.
Okay, hi everybody. My name is Kathy Riley. I'm the lead for the Open Doors Dementia Support Service, and I'm based within the Salford Memory and Assessment team at the Woodlands Hospital, and I work for Greater Manchester Mental Health Service. The Open Doors was formed in 2011 to literally open doors for people with dementia. We work in across 3 areas, one in research, mainly with the University of Manchester on a number of research projects. I work also in the inpatient services at Woodlands Hospital, but mainly my focus is on the community and support groups that we run within the Salford area. The groups we run a follow-on post-diagnostic support group that follows people from diagnosis and in the information they may require when they've received a diagnosis. We run 2 dementia cafes, one based at Elmwood Church in central Salford. Elmwood Church is right opposite Salford Royal, and we run them on Tuesday afternoons each fortnight. And we also run an extra group at the Earlham and Cadishead area for people that live in that specific area. We run a walking group for those that do like dogs. It's called the Pause for Dementia Walking Group at Victoria Park on a Monday morning. And we also run a book club stroke reminiscence group at Eccles Gateway Library on a Wednesday afternoon. That's everything in a nutshell, I hope. Any questions, please?
Barbara's got a question.
Hi, Barbara.
And then Karen. Barbara first.
Do Woodlands, if people are diagnosed with, I've forgotten the word, memory problems, but not dementia, do Woodlands still see them? They used to see them annually. Do they still do that, or is that something that's stopped?
I'm not too sure about that, Barbara. Yes, you're quite right. It's mild cognitive impairment, and the person when came through to us were asked to come back in a year's time. I actually don't know. We're still working at the moment on a recovery plan, so I'm not quite sure if that's on offer. But I will try and get that information onto the chat if that's okay, and let you know.
Yeah, that's great. Thank you.
No problem.
And people. Karen. Oh, sorry.
I could just see a message from Dominic about a timetable or poster. I unfortunately didn't get my information leaflets to Emma on time to get out in the packs at the making, but I'll make sure that my email address is there. And if you want to give me an email, I can send all the information booklets and flyers over to you for all the separate groups.
Brilliant. And Karen, you had a question.
Are they free?
Sorry, Karen. Yes, thank you for asking. Yes, all the groups are free. And apart from the Eccles group, we have good car parking that's free too.
Wonderful. Any more questions before we move on? I think what we might try and do is compile all of that information for you in one go, if that's not going to make a ridiculous sized email. We'll attempt that, and if it's too ridiculous, then we'll do it separately. Okay, Lisa, we're moving on to you. Oh, you're just on mute. Unless you do it in mime, that's fine.
First person to do that today, sorry. Hi everybody, I'm Lisa Dickinson. I'm Chief Exec of Aspire, and I'm going to talk very quickly because we've got a lot going on. First of all, our kind of statutory services. So this is for people who have been assessed under the Care Act of needing kind of day support or day respite. So we have got our Poppy Day Experiences Centre based at Humphrey Booth in Swinton, but we've also got two other day centres, one in Eccles and one in Little Hulton, stroke Walkden, that this is a social worker referral. So these are for people with dementia, complex dementia, and that's to give day respite to families. And we do sensory work, memory work, activity-based stuff with people. So they're lovely, fantastic places, very joyous places to be around. And connected to all of those day centres, we have our kind of community hubs. So these have sort of grown organically. So people have lost people, they've become widows, widowers, and they've just got involved in sort of starting up groups themselves, really. So we've got really loose hands with this. We've got an older person's group called Aspire to Age Better. They've got their own constitution, their own bank account, and actually a lot of our activities are run by our older people's volunteers. So Aspire to Age Better actually won the Spirit of Salford Best Health Improvement Group this year, so we're thrilled about that. You'd have thought they'd won the Oscars, they were that happy. But the kind of things that they do across our centres would be, let me just read this now, there's always something going on and it's generally crazy. They have such a great time. We have lots of special events. We've got choirs, curling, tai chi, lots of games based stuff, lots of singing. We get pet therapists in, lots of special events, and they're all in our cafes, which are completely open to the public, completely free of charge, and all those activities. Like I say, we support it, but we have very loose hands. If you know of any older people who have got great experiences in life, still got a lot to give, want to volunteer, want to give something back, we've got a fantastic group of older people that they can just slot into and get involved with. So that's Swinton, Eccles and Little Hulton. And before I finish, I just really quickly want to tell you about two brand new initiatives. So the first one, which I think is so exciting, is very retro, back to Meals on Wheels of the 1970s. Lots of problems out in the community with people with hydration and nutrition. So we've started an academy, a catering academy for people with learning disabilities. and we've developed with consultants, we've got a fantastic menu of wonderful meals that we're going to deliver out to older people in the community, and those have got kind of low sodium, special diets, easy to eat. And we're not just going to drop meals off for people, we're going to knock on the door and say, hi, how are you doing? And check up on people at the same time for no more than the price of a kind of a, you know, Marks and Spencer's high fat, high salt meal. So we're really pleased about that, especially that we've got people with learning disabilities developing those menus for us. And finally, in Little Hulton and Walkden, we're piloting a community support service. So this is not dom care, and it's not home care, it's person-centred community support. So what a person needs where they need it, with an emphasis on well-being and prevention. So preventing people from declining and getting them involved in stuff in their own communities and moving away from isolation. That was really rushed, but more than happy to talk to anybody who wants any more information about what we do and what we can offer.
Thank you so much, Lisa. I love the Meals on Wheels project. What's it called? It's called Meals on Wheels.
It's called Aspire at Home. The whole thing's called Aspire at Home, and you'll be amazed the amount of older people who want chicken tikka masala rather than the old-fashioned hot pot. Yeah, it's great.
Salford, of course they want that. How much is it, and how do people get involved with Aspire?
Okay, so that's our future one. All our meals are coming in at around £4.50, something like that. So just keep an eye on our website. We've just done some pilots, we've had them out, we've had some feedback, which has been great, and we'll be piloting it, like I say, in Walkden and Little Hulton to start off with. So keep an eye on our website, and all the details will be on there shortly.
Wonderful. Caroline, you've got your hand up.
Yeah, I'd just like to say the cafe's open, isn't it, 5 days a week, and people can go in and have a look at the building, see what's on. The building's fantastic, and the food, I think, don't you do something like a 2-course meal for under £5 or something?
Yeah, we do that in all our cafes. So like I say, mainly in Swinton where the activities are, but Eccles and Little Hulton as well. We've got cafes open to the public, and we have people with learning disabilities, people with dementia, and just people who need company. So it's just a great place to hang out.
Yeah, the food's lovely as well, I must say. But are you not doing an event next Friday at the RHS?
Well done. Yeah, so RHS Bridgewater open to everybody next Friday from 10 o'clock. We've got our Forget Me Not event, so we're planting Forget Me Not seeds with the staff from the RHS, and we did it last year and it was just a lovely event. Age Concern came along, so please, if anybody wants to come along to that next Friday, I think we sent the leaflets out with this event, and again it'll be on our website, which is iamaspire.org.uk.
Wonderful. Any more questions for Lisa? Mary Ann said it was a lovely event last year, Lisa. I've booked myself in for Friday to come down. Love the RHS.
Super.
Any more questions from anyone? Okay, so this is we're gonna broaden it out now. So is there something that you want to ask someone that you've not had a chance to ask? So this is your opportunity. I think we're going to finish early today, so well done presenters for keeping it succinct, and we hope that you've enjoyed the format, but we'll give it another couple of minutes. So if you have any questions that you've not asked anyone, so you might even be a presenter who wants to ask a question, or someone who's come along to watch this today.
I think what has been inspiring about all this is just how much support is out there. And I think we once said we wanted to make Salford the best place to live. And I think with this sort of backup, I think we are making headways in that. I know from experience with my sister, the care that she's got in the north, in Salford, is far superior to when she's actually been away on holiday and had difficulties when she's been at a son's house in Bedford. And they were sort of tearing their hair out, but the support they got, should say, up in Salford was far superior. So I think we have been on the right track for many years now, so we just have to continue and don't let anybody else take over. I think we're on the right track. And we are definitely on the right track. I think everyone that's looking around, everyone's smiling, going, yeah, Salford is a very good place to be. And there are just so many opportunities for people affected by dementia. Caroline, you've got your hand up.
Yeah, I'd like to, if there's no more questions at the minute, but I'd like to say, would people like more of these with different speakers, and just to dip in for an hour, maybe every 3 months? You know, because I think if we open it up and get it as a regular thing, I think people will have more interest in it. I mean, one of the subjects that's very close to my heart at the moment is about the cost of living with people with dementia and carers, you know, and how is it affecting them? Well, we can bring in people like Citizens Advice, etc., all the people that can help, because the more social workers and people frontline and GP people, staff, medical staff, then the knowledge they gain to help people and patients or service users, I think this could be really, really helpful.
Caroline, you've had a resounding thumbs up from everyone.
Oh, good.
And also, I noticed that Maggie, you've got your hand up. Is there a question that you want to ask?
It's more just to say, yeah, Caroline, I think that's a really good idea, because what I've found with clients with dementia or carers is a lot of it's weather dependent as well. So what might be available, I think, with it changing with the seasons as well, like if there's more horticulture, I know there's quite a few horticulture offers available at the moment, but with, like you said, with the cost of living and with things changing so quickly, and yeah, I think it'd be really beneficial to have these quarterly.
Yeah, brilliant. Hi, Andrew, you got a question?
Yeah. So thanks to all the speakers. First of all, it was really informative. So I work as one of the managing directors in the hospital, and we've actually been secured some money as a national programme. I don't know if anyone's heard of this, but the Dementia Front Runner programme as well. So we're coming at it from a bit of a hospital admission and discharge perspective. So I was particularly interested when you talked about obviously groups that you've got with people with lived experience there. So on that group, I think that experience would be really helpful for us, because we're doing it all like people like me who've actually never experienced that firsthand. And well, myself, I'm not actually on the wards, but we've got clinicians and obviously other people who are. But again, that's from their perspective. So I think having people with lived experience, and even people from your own groups yourself, on that will be really informative there as well, and it probably would help us a lot more as well, because again, we the experience, and I think you probably gain a lot from it yourself as well, because again, a lot of you probably had well, Martin has some lived experience, or some people obviously family members or people who've gone through your groups, but the experience in hospital is a very harrowing one for people, because it's not a very nice environment at the best of times, right? And we know we're not doing a great job, and we're failing people really with dementia in the hospital as well, especially with the long ED waits, etc. So we're probably perfectly set up to actually increase people's delirium and dementia at the moment as well. So to have any support on that one for myself would be really helpful. So I don't know if it's anybody on the call is actually interested in yourself, or you could put some feelers out there. But if you got in contact with myself, I'm sure we would love to have input from some of you or some of the people you've been in contact with lived experience in the groups.
Yeah, we work quite closely with Trudy, Andrew.
Right.
You know, because she's patient experienced.
Yeah.
So I work quite closely, and she's part of our engagement network. So, and I share different things, but yeah, I think that's a really good idea, and having someone that can lead the way in hospital, because we work quite closely. Well, part of our forum, our providers forum, is Bev Drogan.
Right. Oh yeah.
So she attends those on a regular basis. So we have got those connections in there. Maybe you being the director might sway to get more things through at that level.
Yeah. Yeah. No, absolutely. Yeah. So I mean, I can contact Trudy, but again, I suppose if anyone wanted to directly contact or be involved, I'm sure we would welcome as much involvement as possible as well to get obviously as rounded a view as we can.
Well, you might be interested. I don't know if anyone else is, but I think part of my remit when I go back to the council is to be starting a Dementia Champions group up again. So I will be looking for people with lived experience and their carers in the next couple of months, and I help them understand what goes on in a meeting, etc., etc. But when I started that in 2012, I went to people's homes and interviewed them individually, and I was just amazed at every single carer broke down crying. Because there just wasn't any support at that time. Whereas you see now, like especially through Leslie's activities, you know, people are out there enjoying themselves, having a good time. There's so much available to them in Salford now, because in 2011, before I think we made the hospital a hub where Cass works. And we had Humphrey Booth Resource Centre. I think people, all they were given was a letter saying you've got a diagnosis, make sure all your legal things are sorted out, and that was it. So now there's so much of a pathway, and I'll send I've updated the steps document, so I will send that document out to everyone if they want it today.
Brilliant, Caroline. I'm just conscious that we've got a few hands up. Andrew, I think it would be fantastic for some of us to come, either we do it online or we come and have a cup of tea and chat about how we can support. Kath, you've got your hand up. Was it to say let's have a cup of tea?
It was exactly that, Andrew. It was just to sort of say about some of the volunteers or people living with dementia that are expert patients. So let's get together, like Emma suggested, and see if we can help you.
Brilliant. Karen, you've got your hand up. Was it to say let's have a cup of tea?
It was to say, I think I've already been in touch with Lindsay, Andrew, but I think if you could share your details, or if we could all get together, that'd be really useful, I think. Fab.
Emma, you've got your hand up. Have you got a question?
Yeah, sorry. It's just to double check, because there's been so much information that all this is going to be put into email, so I can then forward it throughout my team, because there's quite a lot that we didn't know about when we work in the statutory sector.
Emma, we're delighted that you didn't know about it and now you do know about it. So what we're going to do is after this, sometime next week, because next week's going to be a busy one, it's Dementia Action Week, so there'll be a lot of busyness, but what we're going to aim to do is pull all of this together in an email and send it out to you, so you've got everything that you need and all you have to do is forward it on. And we'll also include the link to this conversation, so you can share that out to people if they want to watch it.
Brilliant, thank you. And then sorry, last one, with is it the RHS event next Friday, what was the link for that one, please?
Chris, would you just drop the Eventbrite link into the chat for us?
Thank you.
No problem. Any last questions while Chris quickly drops that Eventbrite link in?
Can I just say that Dance with Dementia are working with Salford Royal Dementia units, and we are taking MP3 players in, and jigsaws and aquasets and comfort blankets and all sorts of things going on. And that I think it's the third lot that we sent in, but this is going to be a rolling programme now, particularly with the MP3 players, because we're now working with a charity called Purple Angels, and we're doing fundraising events to finance more and more and more taking music into the hospitals. I think it's vital that we do get that sort of facility in there for the people with dementia in the hospitals, because at the moment it's horrendous from experience.
Thank you, Leslie, for sharing that. Just as we move into the last minute or so of our webinar today, any final questions or points that anybody wants to make?
Well, can I just say, Emma, I'm going to send an email out after this, so it's very poignant in people's minds and things. If you could just write me a sentence back by email, please, to tell me what you thought about today, because this is really important when I take this back to the providers group meeting to say, should we do this again? What should we do? You know, I'll do a couple of questions on an email and ask if you could answer that, and I can gather that together then to report back to the providers group. That would be really good.
Wonderful. And we could do a very quick version of that as well as, so will you give us a thumbs up if you found this a useful 1 hour of your life?
Me.
Yeah.
Right. Okay. Brilliant.